my first meeting, it was in February, my first meeting to do with COVID-19, thinking, well, this will be here for maybe a month or two. A few people will get ill and then it will be better. And I think that probably reflects what most of us thought. It was something that was happening mainly in China, but we need to be aware of it. But then really quickly, within a few weeks, it became obvious that actually this was going to be really serious. It was going to impact not just policing, but the whole country and beyond. And my job at the beginning was just to be a link from the Federation into the police operation, to move information in both directions. Most importantly, perhaps to give the operational team an understanding of what the front line needed, what the fears and the concerns were of the front line, and also to bring that information back through the Federation so that our colleagues on the street had a better understanding of what was needed of them and what was expected of them. So I expected that maybe I'd go to the occasional meeting, I'd send some information out to members every now and again. But within a month probably of the operation starting, everything ramped up really quickly. There were meetings around COVID-19 several times a day, not just several times a month, several times a day. Different aspects of the operation started to ramp up. PPE was really important right from the start, and I'll talk about that in a minute. But there was other aspects that I'd never even thought of before, like excess death management. How do the police deal with large numbers of people passing away in a short period of time? And these were all things that we were having to give some thought to. So very quickly, my job became focused on COVID-19 more than any other aspect. And I have to say, the operational team at a really early stage welcomed the Federation into that environment, and they really valued what we had to bring, I think. So we were able to help shape and mould policies, guidance. The PPE guidance is a really good example, but there's other areas. We were helping the operational team to come up with a policy around how we deal with people who are off sick with COVID-19, home working. We've never had to think before about huge numbers of officers and staff working from home. So the Federation was involved in trying to shape those policies as well. And probably for the first 4 or 5 months of the operation, 6 months, it was really full on for everyone, the whole of policing. And we became increasingly involved in the police response to COVID-19. As I say, PPE was for a long time the #1 issue for policing. And the reason that is because at the start of the operation, our colleagues simply couldn't get their hands on the PPE they needed in the quantities they needed. I remember the first set of shifts I did during COVID-19, the hand wash was a couple of years out of date, for example, and there weren't enough masks to go around, and we were going on arrest inquiries, and we didn't have the PPE to wear to protect us from COVID-19. We had our body armour and our handcuffs, but that's no good, obviously, against the virus. So these are the issues that police officers up and down the country were having to deal with day in, day out. And the reason for that was there was this huge international shortage of PPE. No one in the world could get enough. So the police took a slightly different approach to how they get hold of PPE. In the past, what you would normally do is you'd order some PPE, they'd deliver it, and then you'd pay the bill 30 days later or 90 days later, just normal practice. Well, that stopped being the case really quickly, and people who had PPE to sell, they were expecting the money up front, otherwise they wouldn't sell it to you. So the police changed the way at an early stage how they go around buying PPE, and they were giving the money up front, and because of that, the situation changed fairly quickly, and probably within a couple of months, we had enough PPE in the country, for the police at least. But then we had to get it to the officers on the ground who needed it, so a couple of things happened. Firstly, we set up a national hub an RAF base, where all the police PPE went, and then it got distributed around the country where it was needed. But that's a really difficult task to do. We're not Amazon. So we had military support to help with that. The Royal Logistics Corps, who were absolutely superb. We've seen how much the military's been involved, but they came into this police PPE hub and helped show the police how to do really efficient and effective logistical distribution. So because of that, we started to see the supply of PPE to forces improve quite quickly. And at that hub, we're talking about police officers, constables, sergeants, inspectors, who have never had to do this before, who've really picked up the mantle and have done an amazing job. And they've had some really good leadership as well. There's a superintendent there who runs the site. There's an ACC who's involved, who've done a great job of leading it. But the actual work on the ground, well, that's our colleagues who are pulling all this together. And then it gets to forces, but we need to make sure once it's got to the force, we need to make sure it's got to the actual officers on the ground. So we saw, for example, Fed reps, chairs and secretaries up and down the country delivering the PPE to stations. There's a good mate of mine who's an officer in Bournemouth. He actually created what they call PPE boxes. So he was putting together off his own back these boxes of PPE that could go into the response cars, so that if you got sent to a job, you knew you had the PPE there. We had health and safety reps up and down the country working with forces to try and make sure that PPE was the right standard and in the right places. So what we saw, and it was, it made you really proud to be a tiny, tiny part of this massive effort, is cops up and down the country pulling together to make sure that we all had the PPE that we needed. So it worked really well once it was up and running. And where the Federation became involved, I guess at a national level, was making sure that we were getting those supplies through, making sure it was the right standard. That was really important. It's no point having a mask if the mask doesn't do what it's supposed to do. So getting involved with the certification to make sure that it was the right standard, that the PPE that we're giving to these brave men and women is going to keep them safe and then keep their families safe. So it was a massive effort across the whole country. And the Federation were really important in that, particularly at force level, helping forces to get the PPE where it was needed. At the start of the operation, my entire day almost was COVID-19 related. Now, as we've gone through the last 12 months, we've all kind of settled down. As we've got more used to living in this new world that we find ourselves in. So things are less frantic now, I guess. At the start, it was just bouncing from one meeting to the next, trying to fit in, doing actual police work in between. Now it's less frantic, which is great. But the focus has changed slightly, and we've seen this a few times actually over the last year. So I said earlier, the focus was on PPE, and then it moved more towards the HR type regulations, and then it moved again and again and again. And now I guess the main focus is around enforcing these regulations. We're in lockdown at the minute, enforcing lockdown. And what that means is on probably two areas. Number one is these regs change so regularly. At one point, on average, they were changing every 4 days. And our colleagues up and down the country, they were being asked to get their head around the fact, oh, the laws changed again, and then the laws changed again. And then there's geographical differences. So if you're in Gloucestershire or South Wales or Gwent or Cheshire or North Wales, there's that imaginary line on a map. You cross that line, the law changes completely. And we've got members of the public crossing that line all day, every day. And our members, our colleagues are being asked to police that. So difficult. Even in force areas, Avon and Somerset, for example, before we went into lockdown, you had one area, Bristol, that was under one set of tiers, and then the rest of the county, more or less, was under a different tier. But if you're a dog handler, say, or RPU or ARV, you're crossing that line every day, all day, and the law changes suddenly. And every time the law changes, we're expected to just know what the differences are. And we came under a load of pressure, the police, because every now and again, something didn't go as well as we'd hoped. Well, that's not surprising if the law's changing every 4 days. So that's a massive challenge. And I guess the second challenge to do with the regs is around some members of the public, and it's a minority, but still, who are refusing to comply. Some people getting tickets time and time again, having parties with 10, 20, sometimes hundreds of people at unlicensed music events, people meeting for protest. As I talk now, we know that there's a protest planned in London in the next couple of weeks where there'll probably be quite a few people to protest against the restrictions. Well, it's our colleagues who are going to be asked to police that. And policing, with all police protest, it's hard at the best of times during a pandemic when you're having to worry about catching COVID as well. So these are the issues that we're putting through to not just the operational team and chief constables, but to government to try and give our colleagues as much protection as possible. Physical protection, but also that protection from unfair criticism as well, because that's not right, it's not on. And then let's not forget, on top of all that, we've got police officers who are being assaulted, threatened, coughed over, spat at, with an underlying threat of, I'm going to give you COVID. And under normal circumstances, it's bad enough being spat at, of course it is. But we've got people, disgusting individuals, spitting at our colleagues, threatening to give them COVID. So when you go to work as a police officer at the minute, you're not just worrying about being assaulted or stabbed or whatever. You're worrying about catching this horrible virus and taking it home to your family. So that's probably where our main focus is at the moment. We had to find different ways of doing our job because it doesn't matter if there's a virus or not, the public still need our help. There's still domestic abuse victims who need our protection and offenders who need locking up. But we have to be mindful that we need to keep our people safe as well. So there were some really good lessons learned at the beginning. So I'll give you an example. We all know, watching this, that the police sometimes get deployed to jobs where we should never, ever be sent to. And we became better as a police service at filtering that out because of COVID, because we knew every time we send a police officer to someone's house, there's a chance that they will catch COVID, or maybe that they will give COVID to the person in that house if they don't know they've got it. What we can't do when COVID is behind us is just rip up those lessons because they still apply in a non-COVID world. We can still be better at how we use our scant resources even after COVID's been and gone. So there's a load of really good learning, and in fairness, forces have started to hold lessons learnt events, and the Federation are involved in these as well, just to make sure we capture the good practice and we don't just rip it up afterwards, because that would be awful. And for the Federation as well, you know, there's things that we can learn in terms of how we keep people informed, how we communicate, especially when we can't meet in person. So we've introduced different ways of working, and they're still going to apply in the future. Different ways of communicating with our members and our colleagues. We can't forget those. We need to build on those and be better. So at an organisational level, both for the wider police and the Federation, there's loads for us to remember and to take forward. And I guess on a personal level, I was naive. I was really naive at the beginning. This is going to be a couple of months and then it'll be fine. And then I can get on with everything else. I was naive to the fact that this was going to be, I mean, a generational event that is, you know, we're going to be talking about COVID for generations to come. And also, had I been able to see into the future a little bit more accurately, I would have probably looked at doing things slightly different. Probably approaching the way that I did my work differently. I was sort of taking quite a lot on my own shoulders, thinking, well, it'll be fine. It's only for a few weeks, and then when it goes on and on and on, that obviously becomes quite wearing. And I think one thing that we're all going to do when we look back in a year or 10 years or whatever I think we'll all reflect that we've had a really incredibly tough 12 months, but I think we should all be proud of how we've stepped up for the public. At a time when we've had colleagues, officers and staff die from this terrible virus, we're still doing an incredible job for the public. And I'm really proud to be a police officer today at a time where we're doing a job that none of us thought we'd ever do, but the public have got more support for us than ever because we're doing such a great job looking after them under incredible, difficult circumstances. So I take forward that pride as well, actually. I'm not very, I don't need this to happen again, ever. But now that it has happened, I think we should all be proud of how we've stepped up to the mark.